Hi there, I'm Mike. I'm from Occupational Therapy. How are you today?
Good.
Good. Mr. McInnes?
Mm-hmm.
And is it all right if I call you Mr. McInnes?
Yeah, that's fine.
Okay. Just gonna sanitize my hands here a minute. Today what I would like to do is to look at your shoulder and see how well it's moving, how far it can move, and also see how strong it is.
Okay.
Does that sound all right?
Yeah, makes sense.
Okay, sounds good. So what I think I would like you to do is actually to just sit on the mat and face that way.
Oh, okay. All right.
I'll take this a little bit. All right, so the first thing I would like you to do then is, can you just with both arms, lift your arms up over your head like that as far as you can go. Way up high. Good. Back down. All right. Thank you. Good. And then I'm going to use this little device called a goniometer and just kind of measure exactly what the range of that motion is.
Okay.
All right. First, I need to expose your shoulder here. Is it okay if I do that?
Yeah.
Okay. And we'll just roll this shirt up a little bit. There we go. And then I can see as well as feel kind of where we're at up here. Yeah, that's great, thank you. And so here, and then there is where I need to be. That. Can you just put your arm down by your side? Just have it relaxed. Good. Okay. So, okay. There you go. Yes, sitting up straight always helps. Okay, that looks excellent. Now, can I have you put this arm, again, up over your head as far as it'll go? Okay. And then I need to get in here. Help it again. There we go. Right there. Okay, can you go any farther? Oh, look at that. All right. Great. Thank you very much. You can put your arm down. Okay. And now what I would like to do is to measure that same motion again, but this time I'm going to do it for you, and you can just relax. Okay? Just let the arm go limp, you relax, I'll do all the work. Okay? So, same thing. We'll find our landmarks. There we go. All right, looks good. And then come up over your head. And again, just relax. Don't do anything. Let me do all the work for you. Okay. Okay, and up. Is this okay?
Mm-hmm.
Doesn't bother you?
That's not the most pleasant thing in the world.
Okay, we'll call that good then. All right, thank you. So the first measurement would have been documented 0/167 or so, and then the second one would have been documented 0/170. Last thing I want to do as far as your motion goes is see what the feel is like in the movement when you get to the end of the movement. All right? We call that end of feel, and it just tells us something about what tissues stop the movement. So just relax again. Just relax, hang out. I'm just going to stabilize here, bring this up. All right, thank you very much. And I would call that a firm end feel. So we have a little bit of motion past the first tissue stop before it stops completely. Okay, so that's all of the range of motion measuring. Now what I would like to do is test your muscle strength. And so first thing that I'm going to do is, can you put your left arm straight up in front of you like that? Excellent, yep, thumb up, that's perfect. Sit nice and straight, and I'm going to kind of stabilize here. I'm going to push down here. So I think I'll come around the other way. I would like to do it that way, but this way it'll be better on the video. So I'm going to stabilize here. I'm going to push down here. And I just want you to not let me move you. Okay? All right, here we go. Hold, 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 hold. Very good. And I would document that as a 5 out of 5. And then we're going to test one of the individual muscles that contribute to that movement. We're going to test the anterior deltoid. To do that, I'm going to just position your arm about like that. Okay? And again, I'm going to stabilize up here. I'm going to push here in this direction. I just want you to not let me move you. Okay? Ready? Hold, 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 hold. Pretty good. Okay. So that individual muscle I would also grade as a 5 out of 5. So now what I would like to do is to just demonstrate how, if it were weaker, I would test that muscle in a gravity minimized position. Okay. So what I need you to do is, go ahead and stand up. I'm going to bring the end up here and grab a pillow. And if you can lay down on the mat facing that way, that would be excellent. Okay. I'm going to take a pillow here, just kind of put it right in front of you. Okay. All right, and then if you can just kind of roll over on the pillow, perfect, about 3/4 there, that's great. Now, the motion we just tested, the muscle we just tested, anterior deltoid, in this position, when it would fire, we'd just do a motion just like this, parallel to the floor. Okay, and I want you to do that same motion. I'm just going to very lightly underneath support you if you need it, but I want you to do the motion just parallel to the floor all the way up over your head. Okay? All right, back down. Great. And then last thing I want to do is to demonstrate how if that muscle were so weak it couldn't move the arm at all, I would just test to see if it's firing at all, if it's active at all. So what I'm going to do here then is in the same position, I'm going to grab your arm and palpate your acromion, clavicle, go down a little bit so I'm kind of anterior to the head of your humerus. And now what I want you to do is just try to push your hand forward.
Okay.
Okay, good. All right, and relax. And as soon as I feel that tense up there, I know that it's intact. And so you would have at least a 1 out of 5, although obviously you have much more than that. I'm going to lower this down for you so you can safely get off. All right, there we go. You can go ahead and sit up. Okay. Do you have any questions, or is there anything else I can do for you?
No, that's great. Thank you.
Okay, thank you very much.
Thank you.
I'm going to go wash my hands.